Hello, everyone. Welcome to today's live broadcast, Training for Team-Based Care Success. I'm Jessica Langley, and I'm the Executive Director of Education for the National Health Career Association, and I'm excited to be your moderator for today's event. This webinar is brought to you today by Medical Economics and is sponsored by NHA. National Health Career Association partners with employers, educators, and organizations to empower people to access a better future in healthcare. NHA provides innovative, accessible learning resources, national certification exams, and professional development with analytics so you can attract, train, and retain top talent for your care team. If you'd like more information about NHA, you can visit our website at nhanow.com. We have a few important announcements before we begin. This webcast is designed to be interactive, and we encourage you to ask questions during this event. You can do that by submitting questions in the Q&A box that's located at the bottom middle of your screen. You can enlarge the slide window by clicking on the small square icon in the upper right-hand corner of the slide window, or by hovering your mouse over the lower right-hand corner and dragging the window to the desired size. We will also be advancing the slides automatically during this broadcast. I also have the pleasure of introducing today's speaker, Owen Dahl. Owen Dahl is a principal of Owen Dahl Consulting in the Woodlands, Texas, and is the author of the new book, The High Performing Medical Practice, Workflow, Practice Finances, and Patient-Centric Care and Think Businesses, Medical Practice Quality, Efficiency, and Profit. He also is the contributing author of the popular book Lean Six Sigma for the Medical Practice and the recently published Integration of Behavioral Health into Medical Homes, a Rapid Implementation Guide. Owen has 53 years of experience in consulting, running a medical billing service, and managing medical practices. He speaks on issues related to strategic planning, Lean and Six Sigma, culture, human resource management, and revenue cycle, among others. Owen was a hospital administrator and is an adjunct professor at the University of New Orleans. He received his bachelor's degree in hospital administration at Concordia College in Moorhead, Minnesota, and his master's from the University of Northern Colorado. Owen recently achieved his Lean Six Sigma Master Black Belt through Villanova University and also served in the United States Air Force. Please welcome Owen Dahl.
Well, thank you, Jessica, and I want to thank everyone who's tuned in today, taking time out of what has to be an incredibly busy schedule in dealing with what's happening. So what we're going to try to do today is to talk about a number of things that I think will be helpful as you're facing challenges today, as well as the challenges that you will face once this virus situation is under control. But I want to stop for just 1 second, and this has nothing to do with the topic, although it may, and that is that 10 years ago on Monday, the Affordable Care Act was signed into law. So we are celebrating a happy birthday to the Affordable Care Act. So when you're washing your hands for the 20 seconds and singing happy birthday twice, you can sing happy birthday to the Affordable Care Act. I think that's pretty exciting. So without any further ado, let's look at what our objectives are today, and that is we want to help understand the benefit of the empowered and trained worker and what they can do and what their objective is in terms of working to the top of their credential to do what, and that is to provide patient care, which is what this is all about. We'll talk a little bit about the training needs of what we can do in terms of team-based care and kind of looking at that, and we'll hopefully give you a couple of ideas in terms of a framework that you could look at and think about relative to where you are and what might happen. I like this particular slide. When we put it in, we were talking about some other things, but trends in healthcare impacting the rise in TBC, team-based care. I think when you start to look at what's happening within your organization today, the changes that are being made, whether you're reducing staff, whether you're addressing the PPE issue, a lot of things that you're facing. I think you'll find that the topic that we're looking at in terms of using the team and the team-based approach will be a big contributor to the success that you have as you think about this. So as we do this, keep in mind that what we're looking at is a concept, a model of team-based care that can not only help you today, but it's really designed to take advantage of all the resources, to take advantage of the skill sets that are available from your employees and your fellow staff members as to what they can do to contribute to that overall objective of improving patient care. Now, the trends in healthcare, when we think about this, look, the whole idea of what's happening with the way we're getting paid. And so I just talked about patient care, and now I'm talking about how we get paid. Well, those two are somewhat interchangeable in the idea that as the models for payment change to capitation, episodic, bundled, the risk scenarios with the accountable care organizations and so on, leading to this value-based care model, there's some significant changes that are occurring which are causing us to have to rethink how we deliver care, how we can effectively deliver care, and what we're doing in terms of utilizing all of the brain power that we have of our fellow staff members and our fellow employees. In fact, Peter Drucker, one of the greater management thinkers in the universe, had a slogan or a concept that I really like, and that is when we're talking about an employee or a staff member, he said that individual is a knowledge worker. And I think that's important to recognize that everyone on our team has that knowledge base, and whether or not we're tapping into it, whether or not we're utilizing that, whether or not we're using that knowledge based on experience, based on education, based on training, based on skills, is really kind of what we're leading to, and that's what value-based care is challenging us to come up with. In addition to that, and again, apropos to today, with the whole idea of the coronavirus, is that we have to look at our community as a whole, and what are we doing in our organization to help work within our community. We have that obligation to treat the entire community, to look at those underserved, to look at those individuals that are struggling. And so in our community model, we have to think about that. But from the team-based care perspective, we also should think about it in terms of what we're doing to help manage our chronic care patients that have those chronic diseases, such as diabetes, COPD, CHF, renal insufficiencies, and that sort of thing. And so as we look at this and think about this, I think the whole idea of what are you doing as a practice, as a medical office, what are you doing to help manage your community, have that impact on your community, and then have that impact on those types of patients that you're working with. Now we're seeing, and these numbers are going to change pretty dramatically, I think, with the whole idea of the coronavirus, is that we're seeing a rapid increase in the demand that goes on, as well as an increase in the pricing that occurs within the healthcare world. Now, the 1:30 this morning announcement that Congress made, the Senate specifically made, that there will be a stimulus package. There will be funds that will be flowing into the healthcare system. So I think that will help us get through this a little bit. But as we look at this, the healthcare is the fastest area of growth in employment, and it's been that way for some time. And wages are going to increase, even though we're looking at our cutbacks today. If we get past this, we will continue to see that kind of thing. And physician and clinical service prices have increased at an average rate of 5.4%. I just mentioned a little bit about access and demand, and I think this is really interesting, that there's going to be more and more demand placed upon our healthcare system. More and more need for transparency, more and more need for that big 5-letter word of trust, We're talking and hearing a lot about telemedicine and the application of telemedicine today. How are you going to, in your practice, manage these particular changes? How are you going to take advantage of the knowledge base and that knowledge worker in terms of where this heads? In addition to that, we have patients who are indicating, saying, these are some things that I think are important to me as a patient, and that is how the proximity to the facility, the fees, the whole out-of-pocket, the high deductible plans, copays and deductibles, even the quality of service and that we are providing is being measured on a routine basis. So all of these things are leading us to the idea that we maybe and should challenge ourselves to change how we deliver healthcare to our universe. So what is team-based care? Let me start out by asking a question, though, of all of you who are participating. So the poll question is, do you use team-based care approach in treating your patients today? And I think that's a good question. So the question is, do you use team-based care approach to treat your patients? Just answer this by clicking on a yes or a no. And we'll give you a few seconds to answer that question. And then we'll see what the outcome is as to where we go. And I haven't really defined team-based care to any great extent yet, so it may be a little bit early to ask the question, but by the same token, this really challenges you to think about this. Do we and are we using a team approach to what we have in our care model? Interesting. We've got a result that says about 79, almost 80% of you are using team-based care as we speak, and about 20% are not. So I think I may be preaching to the choir, and there may be some very good insights that some of you would be willing to share as we look at the idea of what we're doing within the idea and the model of team-based care. So the technical definition of team-based care is working collaboratively to the extent preferred by each patient to accomplish shared goals. Wow. Have you ever thought about that? To work collaboratively to achieve shared goals with the patient? Maybe that's what you think you're doing when you're individually working with each patient, but are you doing it as a team and a team approach? 80% of you say that you are. I think that is awesome, and I would hope that we could get to a point of 95 or 98% of our medical practices that are taking advantage of all the brain power that we have. And permanent teams are really critical for having that relationship with the patient. That gives you that stability, that helps with that big 5-letter word of trust that I mentioned earlier. So I think we have to look at this and say, are we in fact accomplishing and doing the things that we want to do? Here's an interesting slide from the University of California, San Francisco. And it's applied to primary care, at least that's what it says, in terms of rethinking primary care. But if you look at it and think through a little bit more about this team-based idea, there's two perspectives that we should think about. One is, what do we do internally? And then two is, how do we relate to other providers within the healthcare system itself? So here we have a situation on that left-hand side where it says in the lower right-hand corner of the chart on the left-hand side of the page, it says patient doesn't follow up. And that is one of the risks that we have in the current model as to whether or not we're really, in fact, reaching and achieving the actual outcomes that we are expecting to have with our patient. The other thing is on the right-hand side, I think, and if there are physicians that are listening, I don't mean to step on your toes, but I think in a lot of cases when we go into a medical practice, the concept of providing care is physician-centered rather than patient-centered. And again, I don't mean to step on anybody's toes. That's not my point on that. My point is that it's important for us to be able to look at this whole idea and say, are we in fact focusing on the patient? Is the patient the center of what we have? So why do we want to do this? Well, let's coordinate and connect with the patients to provide their care. I think, again, that patient-centered idea is really critical for us to look at and to think about this. But I also think we can increase efficiency and productivity. And when I say that, if I think about the positions that I see as a patient, how many times does the physician spend, how much time does the physician spend keying in on the keyboard rather than actually looking at me or paying attention to me? Are there things that can be done? Can we use mid-levels? Can we use nursing staff, medical assistants? Can we use even the receptionist team that we would have? What are we doing to have them become part of our process to what's going on? So we're looking at patient, we're looking at efficiency, we're looking at improving access. There's more and more demand for the care, and when I try to get appointments with certain physicians, I'm maybe looking at 2 to 3 months, maybe even 6 months out to have a quote-unquote more routine kind of follow-up visit. So how can we help fix that? And then what can we do to reduce MUDA? MUDA is a term we use in Lean Six Sigma. It's a Japanese term that really speaks to waste. And I think right now is a good time for you to ask yourselves a lot of questions about your current delivery system. Does it include waste and so on? And we'll kind of identify some of this as we go through further with our discussion today. And don't forget the Q&A kind of session at the end of our time today. So please feel free to type in a question as we go through this. Excuse me. Okay, the advantage of doing this is the patient feels that they're respected. They feel like they're getting care. They're involved. They're engaged. The patient may have better access to our systems, and so on. The teamwork allows us to work at the top of our credentials. So the skill set, the knowledge that each of you and each of your staff members have is actually implemented and utilized for that care process with that treating and that whole patient. Hopefully we reduce the emergency department visits, and hopefully we reduce the access or the readmissions. Hopefully we take advantage of things like chronic care management. We may take advantage of telemedicine. We may do a number of other things that can be developed and thought through and more effectively managed by the team and the team working together and how that all fits together. Now, the next couple of slides, maybe, well, okay, you don't have to talk a lot about this, but I really wanted to just kind of emphasize the idea that an effective team has certain key components and key points, such as a very clear purpose. Well, what's the clear purpose of your daily interaction? What's your clear purpose for working with a patient that has diabetes versus a patient that's coming in for, say, their annual wellness exam? Those are different kinds of perspectives. So each patient may require a refocus, but the team itself is having a purpose of actually being able to be flexible to deal with that. The informality, the participation, the listening that we would have, even consensus decisions. Now that may impact some of the docs who feel like, oh wow, I don't want to have somebody else make some decisions. But again, if we engage our brains, there may be something there. So open communication and redefining or defining the roles and the work assignments and that sort of thing. So again, I hate to read all the words on the slides. You can look at these later as you think and work to develop your team. Now, many of you have probably seen this kind of model that suggests there are 4 stages for a team, and that's forming, storming, norming, and performing. What I really want to emphasize here is that if you're using team-based care, every time a new employee comes to the office, you start back at the forming stage because you're forming that team and reforming that team into something that has never existed before. So as you think this through, it's easy to say, okay, welcome to our team. It's nice to have you participate with us. But the next stage is very critical. And those of you that are in leadership roles, take a look at this and think this through, that there is going to be a storming stage, which means that somebody's not going to like whatever the new employee brings to the table. They're not going to like what they did in the past. They never have liked them. Who knows what the storming component would be. But be aware of that. Don't fight it. In fact, what you do is you look at it, understand it, accept it, and then manage it. So that once you get past that leads to norming, which means, okay, we've gotten somewhat stabilized and we're okay at this point in time. But you finally reach the level of performing, which is the optimal level of being able to contribute to that needs for that patient and that patient care situation that you have. Now, when I talked about the storming stage, I also think it's important for you in the leadership role to recognize that there are going to be certain situations, certain types of things, certain personalities that are going to come in the way. So you're going to have those dominant or overbearing participants who are going to try to control different things. You're going to have those shy members who are not going to be willing to speak up, and they're going to sort of just take whatever happens. And so there's a lot of different components to the idea of how you manage a team, and there's a lot of ideas here where you would be, as individuals, need to recognize your particular role. If you tend to be overbearing and dominant, maybe it's not a good idea. Maybe it's wise to say, you know what, I think it'd be good for me to listen to what others have. Those of you that are shy, maybe it's wise because you've got some pretty good ideas that the team would benefit from. So the goal would be that in that storming stage, and then as you continue to progress, is to recognize that there are these different challenges with the staff members that you have there. So again, that's sort of basic team management kind of thing, but I think it's important to say, how are we doing, what's going on with my team, and how does my team sort of fit together? So as we look at this, then I've got a slide that is interesting, because if you take a typical patient visit, there are 5 steps. You've got the entering or the receptionist area, you've got the triage, you have the interaction with the physician or the clinician, then you have the post-activity that occurs, and then finally you have the discharge or the checkout component. I don't think anyone would argue that those 5 steps are not part of pretty much every patient visit. And so as we think this through, each one of those steps, each one of those components there has a very specific purpose in pushing and going through the entire patient care process. So I like this slide to give you that image and to give you that idea. I don't like this slide because of what? The first word in the upper left-hand corner says silo. And what I'm concerned about there is that I just do my thing. I don't care what anybody else does. And it's important for me to be able to check the patient in, answer the phone, copy the insurance cards, do all the other demands that I have, and I don't care if anybody else does whatever they have to do. Well, in terms of a team-based approach, we really need to have what we're looking at here, more of a connected process, and making sure that the patient actually flows through the system. So as we think about team-based care, it's not just the clinical component that's critical. It's that check-in, it's that check-out, it's the billing process, all of the components that go into how a patient care is managed are really critical. So as opposed to we think about this silo approach here versus the connectivity approach in this image of being connected and being able to work together, I think this is really a critical piece for you to think about. So if we go back to the team development stage, a new employee comes in at any one of those stages, you then end up with how do I form, how do I storm, what do we norm, how do we get it to the performing stage. I think it's really important to do. So as you're thinking about this, so if you have, and the 80% of you that are using team-based care, I want you to be challenged to rethink how your team is structured. The 20% of you that does not use team-based care, follow this kind of model. Who's going to be the leader? What kind of leadership is there? What's the mission statement and what are the values? And when I say that, that's not only the mission statement and values of your medical practice, it also are mission statements or values of your team itself. Who's on the team? How do we define the roles? Do we need to redesign how our facility functions and flows? Maybe we do. Maybe we can adapt some different ways of looking at things. Then what do we do with the pre-visit, with that initial phone call, setting up that appointment? What do we do during the visit with that flow? And then what do we do with the post-visit? So if we go back to our 5-step model, oh, wait a minute. We didn't have on that one the pre-visit, and we didn't have on that one the post-visit. Those are most important as well. Got a little phrase down there that says huddle or AAR. An AAR is an after-action review. And what I would encourage each of you to do is, in terms of developing your team, is either the first thing in the morning or the last thing in the evening, get together to have a review of either what happened today or what is happening, or what happened today earlier in the day, or if you do it in the morning, what do we expect to happen during the rest of the day? I think a huddle or an after-action review, that kind of thing is really going to go a long way in terms of managing your team. And there's where you get into controlling the dominant personality, you get into controlling and encouraging that shy personality to come in there. So identifying who's on the team, obviously, here's a list. And, how do you form your team? Who do you have on your team? You can look at this list and develop it from there. The implementation approach. One of the keys in terms of where you are in terms of team-based care is buy-in from the leadership. And that is, does your organization accept the idea of the leadership and the having leadership come together? How are communications handled? Who's going to be making decisions? And when are decisions going to be made? Who's actually going to hire the right team members? What kind of job descriptions do we have? And do we need to change the job descriptions? Effective training. Maybe our metrics will help us looking at our what we call key performance indicators or KPI in terms of looking at the productivity. And what are we going to do then to recognize the success and to continue to complement and to continue to work with the team and so on? What are we doing for these warm handoffs from the receptionist to the triage member to the clinician, back to the to triage or to the medical assistant or the nurse, and then back to the front desk? How are we going to do this? That bottom bullet is really important. Patient is owned by the whole team, not just the physician. And we've seen many times, in fact, a study that suggested that about 84% of the time that a patient is in the office, they are working with other members other than the clinician. So 84% of the time, we are having an impact, whether we're team members or not, on the care of that patient and how that patient perceives the care that they have. I like this particular approach and would encourage you to think about this for every single step along the way, that every employee acknowledges the patient by greeting them with their name, giving some eye contact and smiling. And that means that when we talk about engagement, we're really talking about body language and tone of voice are just as important as what words we say. Introduce yourself and your skill set, your level of professional certification. Let the patient know how long this step will take and what they can expect will be done during that step, explaining to them what to expect and what's going to happen with that, even how to contact you, and then saying thank you. Now, isn't that interesting that the last word that a patient hears as they leave the office is thank you? And we're saying not thank you for being sick, we're saying thank you for choosing our office for your service. I like this AIDET model, and I think it would encourage each of you to think about this as each member of your team goes through, or the patient goes through and interacts with each member of your team. Now, there are implementation hurdles. It's easy for us to say, oh, I think this is a really good idea. I really want to get my team members and my fellow staff members involved. But we have, certain hurdles that they have to overcome, such as the culture of the organization, back to the leadership role, back to the decision making. How about the interactions? In some cases, there may be a requirement to interact, which could disrupt the flow. I guess that happens already with phone calls and everything else that's going on. How about education and training of the individual employees, clarification of roles, and so on. So I think it's important to think through, as you're developing this, not only then that forming, storming, norming component, but also to think about these implementation hurdles. And that second to the last bullet where it says patient acceptance. Patients may say, I just want to see my doctor, as opposed to actually participating or being involved with an overall team process. So there may be some transition that's going to be required and some steps along the way that you would want to deal with relative to what happens with the patient. So let's get another poll question. Given everything we've just talked about, what would you consider to be the biggest hurdle in your practice? And that would be culture, training, staff interactions, or patient's acceptance. So I've given you 4 different alternatives that you could think about in terms of looking at that. Now, and again, I'll give you a couple of seconds to actually think this through. What do you consider to be your biggest hurdle? Now, that 80% that actually has team-based care has probably experienced some of these. So think about what you've had as a hurdle in your evolution. But think about the 20% that does not have this. Think about, what do you expect will be your biggest hurdle? And it's worthwhile challenging you to look at the previous slide as well as to think about this particular scenario. So this previous slide had this entire list here, and we've just chosen 4 of those for our poll question. So let's see what it looks like. Okay, that's interesting. 55% think it's culture, 20% training and staff interactions, and only 5% patient acceptance. Big word there with the culture that exists and what you have to look at and how that kind of scenario fits together. Wow. And I think I'll spend just a minute on that as we look at this and as we think this through a little bit, because if we go back to this previous slide, first word I put up there was culture and the nature of interactions. Well, the culture idea really comes from the leadership in the organization. And what is the organization doing? And how is the organization actually working with you? How are you going to convince your providers that you think that the discussion we're having right now warrants further discussion and that we should be implementing some team-based care in our practice? I think it's really worthwhile, and I think if we have others that have had experience with this in the Q&A session, even if you've got a comment or two that might help us in terms of looking at where we can go with that culture question, I think that's really critical. Probably one of the bigger components there is we think about the physician and the physician mentality, and that they have been trained to make decisions. They're trained for every 15 minutes to have another decision about a particular patient. They're not going to want to take a lot of time to have to interact with someone else on the team and how that might work and where that might fit together. So I think that's really a critical point. I'm so glad that that surfaced as the top component hurdle that we have. In a previous life, I was an administrator of a rehabilitation hospital. And one of the key benefits that the rehab patient had was that there was always team members and team approaches. So the physician leader of the team actually took the lead, obviously, but what they did is they said, okay, from physical therapy, occupational therapy, speech therapy, recreational therapy, diet, nutrition, behavioral care, those different kinds of things, how does all of that contribute to the patient and what the patient benefits are? So if we extend that to your practice right now, that physician may be the leader, or the nurse practitioner, the clinician may be the leader of your team, but how does that particular position and how does that particular role play itself out when you have knowledge from the medical assistant who knows that patient from because they socialize with them? How about the nurse who has a particular skill set in observing things? Maybe there are other players in the team, from the technicians to the behavioral component that you would have. How does all of that interact to what? Accomplish our major objective, and our major objective is to improve patient care. So as we go back here and we see this, it's even greater now that we look at what our results are. 58% suggest that culture is an issue. Training and staff interactions and then patient acceptance actually came up a little bit. But I think the bigger message that we have for you today to think about this is, okay, what does this really mean to me? And what am I going to do with regard to the hurdle, and where do we go? Talk a little bit more about those barriers then, and to suggest that they could be in any one of these three major topic areas. Structural, okay, that's your mission, your vision, your purpose. Maybe it's a lack of coordination. Maybe there's things even in your EMR that are not contributing effectively to what you can do and kind of where you go. Procedural, how about that ineffective communication? If you're not having huddles or an after-action review, if you're not doing effective communication throughout the day as you're treating patients to help you manage that flow, to help you address that one particular patient need. A failure to recognize the culture, education, and language differences, things like that's what we picked as our big hurdle. Performance measurements and alignments, underuse of different measures, the key performance indicators, how successful is the investment. Maybe one of the best ways that we can do in terms of dealing with convincing the physicians that this is the right way to go is to have a baseline key performance indicator and then talk about where it is in 2 months or 3 months as to what happens. Not only patient volume, but patient revenue and different things that we would be looking at. Oh, here's a poll question. I guess it snuck back in here. We'll skip that slide. Now, one of the things that we did identify was training. And you picked that as one of the the second or third component. What are we going to do for training? I think it's important for us to think about the idea that we are looking at a change in our culture. Cultures are not easy to change, and they're not going to change by somebody sending out an edict that says this is what we're going to do. If you think about how you implement change within your systems, with your computer going from EMR A to EMR B, and it's a cutoff date of 1 day, that's fairly easy. But not easy in terms of the results, but it's easy to say we've changed. But if you're making a change in how you do things, what happens with that change 1 week, 2 weeks, 3 weeks down the road? Do you have a follow-up system? Do you have a learning organization that you can work on with the particular individuals that you're involved with? What about that patient and staff engagement? What about communication? Now, back up to engagement for just a second. And communication, and put those together. Because I mentioned body language and tone of voice. When we think about how you communicate and work with not only how you would work in the leadership and developing your team, but how your team engages and communicates with a patient or even amongst themselves, roughly 58% of that communication model is built on the idea of your body language, and 33 or 34%, something like that, is built on the tone of voice, and only 7% of the interaction is really built on the idea of the words that you use. So what you're doing in terms of your team and how you integrate this into your culture is that you talk about how can we better engage, how can we better communicate with our patients. Patients actually are resources, And I think that's an important idea. Now, there may be some of you that think, oh, they're not resources because they come in with this idea that they saw this advertisement on TV that they have to have this particular medication, or they went to the internet and they now came in with their own diagnosis. Well, patients can be resources in a lot of other ways, and that is if we listen to them, if we get them engaged and have them be more participants with us. And that means that medical assistant, that certified medical assistant who greets that patient in the triage area can become very important in terms of listening to that patient. What do they really want? Why are they there? And what can be done to have them and help them move forward through the system? So I think that's an important piece as to where we go. And then training, meaning, again, having regular team meetings. We'll talk a little bit more about some training things in a few minutes, but obviously, again, effective training, effective communication, standardization, patient-centered care. We've seen a lot. If any of you have looked at a lot of the literature lately about physician burnout, that's become a big topic because the EMR changes, the continual demand for more and more patients wanting to be seen, the changes in terms of the type of care that are provided and so on. But I want to caution you that it's not just physician burnout. It can be personal. I mean, you may be burned out, and your team members may be burned out. And so I think if you keep an idea out there that what we really want to do with this team-based approach is that we reduce the demands and we offer assistance to each other, that may in itself reduce the burnout as to what goes on. And then that bottom bullet that says career laddering, I think, again, a lot of the younger folks today are very interested in personal growth and personal development. It's well worthwhile for you to invest in them and make sure that they have that opportunity to do that. And as we think about this training kind of thing, another thing that's very important for you is to remember that you're teaching adults. You're not teaching a 5-year-old not to put their hand on a burner. You're really talking to someone, whether they're 18 or 35 or 55, you're talking to someone who has that number of years of experience, that number of years of education. And how are you going to help change that particular individual and assist them in their own personal growth and looking at that? Part of that, and a big part of that, starts with looking at their own personal goals and what their own goals are as to what they want to do. Marry those goals together with the goals of your team, and then marry those goals of your team together with the goals of the organization to be able to deal with that. Another bullet on there, the third bullet, I think is really critical, and that is, allow people to talk, not to dominate, but allow them to challenge the ideas and the concepts. Maybe they've had some different experiences that would be really, really good for you to hear as you develop and kind of move forward with what's happening in the organization. So this slide, why does this slide fit into something about team? Well, if you're going to develop a team, get them past the storming into the norming and performing stage, you have to recognize that that individual is important to themselves as well. And I mentioned a few seconds ago the idea of the individual team members' goals. Well, one of the things I like to do in my annual evaluation process is to talk about what their PDP is. What's your personal development plan? In that personal development plan discussion, there should be some focus on the development of the team, the participation in the team, taking a look at the team-based approach and how that fits. So as they develop and as you encourage and work with staff members in terms of personalized development plans, take a look at this and say, okay, what can we do and how can we move forward with this particular scenario and make sure that we're doing a personalized development plan. One other real quick thing about the learning idea here is that individuals learn by seeing, they learn by hearing, and they learn by touching. So the visual, auditory, and kinesthetic are key components that we would want to think about relative to what happens with those individuals and how they are in fact learning. So when you're talking about training your staff, putting your team together and making this happen, and getting your participation to become part of the team, again, the second and third points in our survey suggested training and team participation and so on. Being aware of these types of things, the adult learner, recognizing that maybe we have to communicate visually and open and auditorially. Maybe we have to have more experiences as part of our training model and part of our teamwork will help us in enhancing and putting together this whole scenario as we look at what goes on. So we have another poll question. This will be our last one. If you were to implement a team-based care approach in your practice, what would be your first step? Gather more information, develop a formal proposal or plan, design a training program, or do a pilot test with one doctor. Again, the idea here is what would be your first step? Gather more information, develop a formal proposal or develop a formal plan, design a training program, or do a pilot test. Again, we'll give you a couple seconds to answer this particular question and kind of see where it goes and how it fits. Okay, 86% of you say gathering more information. Well, I hope that what we're doing today is giving you enough incentive to say, let me go and do an internet search. Let me see what I could do. Let me talk to others who are participating in this particular program to gather that information. Develop a formal proposal, develop a training plan, and then do a pilot test. I would have expected that either one or two, in other words, gather more information or develop a formal plan, would have been the first ones. And the design a training program, that would seem to me to fit into the plan that we would have. But I really appreciate the fact that you've all taken time and responded to this polling question that we've had. So we kind of wrap up with a couple of little other comments here, and then we'll open it up to Q&A. But I just wanted to mention, again, if we are developing that training plan, if we're gathering more information, if we're looking at this, one of the key words that managers and key roles that managers have is to be a coach. And I like the idea of coaching because if you think about a professional sport, a professional athletic team, there are coaches that are there all of the time. They're working on communication and attempting to help improve the performance and providing support. Now, if you think about on the basketball court or the baseball field or football field, the coach doesn't run out there in the middle of the play and say, well, you should have done this and you should have done that. The coach has either done one of two things. They've either communicated, this is how you do it, repeated, use auditorial, use kinesthetic, using visual, recognizing the adult learner and so on, and help that individual better understand the right way to perform and the right way to do that. The second part of what the coach would do would be to, after the fact, suggest that, well, you not tell them what to do, but encourage them to answer the question. How might you have done this differently? What could you have done better, and so on. So as a manager or a leader in an organization, the role of coaching becomes very, very important. And helping develop this team then, what you're doing is keeping in mind what the purpose and mission of the team is and making sure that you're moving forward in that direction. The other thing that I think could help in terms of teamwork and team development is to mentor. Now, what mentoring is where you take a fellow member on your staff and assign them to work with that new employee. So maybe this is a good way to get through the storming stage of helping that individual employee better understand what their role is and how they better fit into the functionality of what you're trying to do. So mentoring that staff member means staff to staff, not manager to or not leader to the individual. It's more important to what goes on and how this sort of fits together. So I think those are two distinct roles that you could use and should follow as you think through what's going on in your organization and kind of where it is. So kind of summarizing what we're talking about here is to that big bullet on the bottom, outcome, improve patient care. Well, how do you do that? You're talking about forming and working within this team, encouraging your commitment to team-based care, identifying a roadmap and taking it and looking for the advantages of dealing with what goes on and how that fits together, recognizing the time necessary and the commitment that it requires to make this stuff happen. So I think it's very important that you do, in fact, take a very serious look at what goes on and how this fits together in kind of summarizing this. So I think what we have now is, I hope, some of that information that you've been looking for in terms of what goes on within your organization and how this sort of fits together. So again, in summary, get this commitment. I believe very much. In fact, let me just stop for 1 second and have you think through what's going on in your practice right now with the coronavirus and your reduction in staff, whatever kind of scenario you're facing. Let me challenge you to think about something else then as we summarize this and move forward with the goal of improving patient care. Let's assume for a second that this whole virus thing takes 3 months. So it's 90 more days before we actually can sort of quote unquote get back to normal. Well, what is normal and what will be normal if we've used telemedicine, if we've done other things in terms of providing patient care? I think now is a really good time. Now meaning maybe a week or two from now if your office is stabilized and working through the virus thing. But there will be a point where it will be a real interesting challenge to you to say, maybe we could do this team-based thing. Maybe we could do this team-based thing a little bit differently than what we've done it in the past. So I think it would be well worthwhile for all of you to say, this discussion today challenged me, it encouraged me, I want to gather more information, I want to develop a formal plan, I want to revise our current team approach, I want to implement a new approach with our team-based care. So I think that's really important. And what I'd like to suggest is that what we could do now is turn it back to Jessica and see if we've gotten any questions. My contact information is here. You can contact me at my website, odahl@owendahlconsulting.com. And I think I'd be more than welcome to, if we don't answer your questions or don't have time to answer your questions today, please feel free to email me and see what we can do to help you with that. So, Jessica, let's see what we have for Q&A.
Owen. You got it. Owen, thank you so much for an informative presentation. Before we get started on the Q&A session, I'd like to remind our audience how to submit any questions that you might have. You can do that by typing them in the Q&A box, which you can find on the bottom of the presentation window. So, Owen, here is our first question. And it kind of goes to that outcomes that you were talking about, patient outcomes, or perhaps an ROI of implementing team-based care. And they asked, do we have any hard data that team-based care works? So actual reductions in ED visits, a reduction of readmits, reduced A1C and diabetes. I've heard increased, retention of your employees and increased both patient and provider satisfaction. So can you speak to any of those?
Wow, I love that question, and I love the statements about, okay, the A1C scenario, the patient employee retention and reducing overhead. I think I don't have any data specifically that says any one of those outcomes has improved as a result of team-based care. I think that would be a really fun a project and a research component to do. I will say anecdotally that it makes sense that if you, for example, one of the question or aspects was retention of employees. We know that retention of employees is difficult. We know that the younger generation is more mobile and is interested in moving from job to job, and that they're looking for a training and educational and participation opportunities. So the point I make there is that we know that a survey by SHRM, the Society of Human Resource Management, suggests that it costs about 70% of an employee's annual wage to leave and to replace that individual employee. So if we're talking about reducing, or costs and controlling things, reducing that turnover rate and upgrading and retention kind of thing, you're saving significant amount of money. And that money is not necessarily just in terms of direct cash. It's allowing you to utilize resources more effectively. So I think that's I wish I had some hard data to suggest that, but I think that's very important for us to track. If any of those organizations that are doing team-based care have any hard data, it would be great if we could find a way to communicate that. And I'd be happy to be a vehicle. If they would email any hard data that they have to me, I'd be happy to share that with anyone who'd be interested.
Sounds great. Thanks so much. We have another one here. Is how does this work with the increased use of telemedicine? And you mentioned that in light of the COVID crisis that we're in, and that being an alternative that we're really looking towards to kind of close the gap.
Well, again, another very good question. About 2 weeks ago, I worked with a practice, and they didn't have telemedicine. And what we did is we got a bunch of folks together and said, how can we make this stuff work? And it wasn't the physicians, it was the team. It was the IT folks, the medical assistant folks, the leadership of the organization who got together and said, this is what we can do. Now, in terms of telemedicine, as far as direct patient care is concerned, there are things such as how are you going to schedule patients? It isn't that we just patients call in or we call patients. There has to be some scheduling. There has to be some even collection once the COVID thing is done of the copays and so on. What other information does the clinician need to have and putting together? I think the evolution of telemedicine and the use of the after-action report or the use of the huddle will be very critical in terms of the success that we would be looking for in terms of implementing telemedicine. Telemedicine is going to be really, really critical for us in the long run, and I think that we should actually then identify that and deal with it. So I think. I hope I'm answering that question. I'm sort of rambling here, but I really believe that an individual, one clinician cannot manage effectively the whole telemedicine process. It requires the team to be behind that clinician encounter with that patient.
Wonderful. I'm looking at one comment or question, suggestions that came across, and we can kind of put this into a question as our last one as our time is running out. They say, we talked about cultural being kind of the largest area to overcome when implementing team-based care, and they ask here or suggest we have an issue. It's not an issue of providers not willing to give up control and allow members to function at the top of their credential and training level. Do you see this, and what can you do to maybe combat this or help those providers feel more comfortable with the change?
Oh, wow. Wow, this is cool. The answer, I think, goes back to the very first question. Do we have any hard data that proves that this kind of thing works? So I think that, yes, the physician, the clinician is in control. They've been trained to be in control. But I think hard data makes a big difference in terms of identifying, hey, this is what can or should be done.
These are the results. So you get a key performance indicator. So you get a baseline that says this is what our number of visits are. This is what our revenue is per visit. This is the number of visits and patients we've seen per day. Whatever metric you have, build that baseline. Say we want to implement this, and I like the idea. And I didn't emphasize this too much, but I like the idea of suggesting that there be a pilot test, that one or two doctors that may be in the group willing to have them help you pilot it, and as they pilot and go through the development of their program, they might be able to have that key performance indicator that would make sure that things would work. So, and the other comment I would make, this also may be generational. There may be some of the traditional or baby boomer physicians or clinicians that are not necessarily open to this as much as, say, some of the younger physicians or clinicians may be. So as you think through, take a look at, find that one champion who can help you in your organization, develop your baselines, and kind of move forward from there.
Great. Well, unfortunately, we are out of time for today. Those of you who submitted questions, we may use these for future topics in the future. So thank you so much for submitting those. I want to thank the audience for attending and for participating in today's event. Also, NHA, we were happy to sponsor this event as well and for making today's educational webcast possible. Again, you can see there is a slide with a little bit of background information on our organization. We do offer team-based care and health coaching training resources for your practices. So again, check us out at nhanow.com. Following this, the conclusion of today's webcast, you will receive an email alerting you when this webcast will be available for replay, and you'll have access to the PowerPoint presentation as well. We encourage you to forward that announcement with the link to your colleagues who may have missed today's live event so that they can also experience the information provided today. We thank you all again for joining, and we will see you next time. Thanks so much.